I call Chris Lyttle, and 10 minutes.
Thank you, Mr Deputy Speaker. I too rise to support the debate today, and I thank Mr Sammy Douglas for securing the debate. Mental ill health is no respecter of party political background, and I've welcomed the opportunity to work with Mr Douglas at constituency level. And indeed, I think it's incumbent on all the MLAs for East Belfast to come together and work together on this issue. Mr Douglas mentions an area action plan and refers to some of the mapping exercises that are ongoing at the moment. It's my understanding that East Belfast Partnership, East Belfast Health Strategy Manager Linda Armitage is overseeing some of that work. And it's been my pleasure to redirect some groups towards the Belfast Health and Social Care Trust, South and East Belfast Mental Health Community of Interest Group. It's a bit of a long-winded title, maybe they'll reconsider that at some point in time, but it is the working group bringing together groups from South and East Belfast to focus on this issue. So hopefully the MLAs for the area can work together and support that work as well. I'm grateful for the opportunity to contribute to the debate on what's a serious issue, not just for East Belfast but across Northern Ireland. And as we've heard, it's increasingly the case that many of us will have direct experience of mental ill health. I have close friends at the moment who are dealing with the issue, and indeed lost a close friend. A friend of mine with exceptional abilities and from a background wide and diverse has been mentioned, lost him to suicide a while ago, and pay respect to him. It's true that for many years the issue of mental health has carried with it a stigma that has prevented people from accessing the help that they need, and I hope that the Assembly will play a leading role in defeating this unnecessary shame and providing the resources to which people are fully entitled to in relation to this issue. I think it is important to base an examination of provision on evidence, and I would like to thank Assembly researcher Dr Leslie Ann Black for the work that she's done to examine the extent of mental ill health in East Belfast compared to other constituencies in Northern Ireland. The facts about mental health illness amongst people in Northern Ireland speak for themselves. And as has been alluded to, it's estimated that 1 in 4 people within the region will be affected by mental health problems at some point in their lives. As has been alluded to by Mr Copeland, there's a difference in terms of mental health problems in Northern Ireland and in England, Scotland or Wales. That's put at about 25% higher incidence here in Northern Ireland, which does of course come from a legacy of years of violence and a divided rather than shared society. And I would agree there's a lot of work to be done in relation to dealing with unique interface challenges. There are a range of indicators which allow us to examine the extent of the problem in East Belfast, and we have been mentioned throughout the debate today, but we consider indicators such as self-harm admissions, antidepressant drug prescriptions, suicide rates. They do show that East Belfast is in need of assistance in this area of provision. Statistics show that East Belfast is the 3rd highest constituency in Northern Ireland in hospital admissions for self-harm, the 4th highest dispenser of antidepressant drugs, and has the joint 2nd highest suicide rate of any constituency in Northern Ireland. I know that the increase in suicides is of serious concern to the members present today and to the Assembly, and that Minister Poots is committed to responding to this painful and difficult issue. But it's clear there can be no more painful and consequence of mental ill health for any family than suicide. And in mentioning that, pay tribute to the work of the Survivors of Suicide organisation under Bobby Crossgrove and Bobby Duffin for the work that they do to highlight the need for assistance in this area. Mr Deputy Speaker, there are approximately 1,000 patients on the GP register in East Belfast with a mental illness. However, unfortunately, there does appear to be a lack of available resource to cope with this at present. Mr Douglas has alluded to contact that we've received from New Life Counselling in the run-up to this debate, a charity that supports the emotional health and well-being needs of people through the provision of counselling and therapeutic services across Northern Ireland. And it is quite worrying that despite this organisation being based in North Belfast, that between April 2011 and March 2012 it received a total of 120 referrals from East Belfast, from 16 separate East Belfast GPs, along with self-referrals from people within the constituency. So it's worrying also that the people who availed of the services provided by New Life did so without any proactive promotion of the charity's work within the constituency. And I know there are many other organisations who can bear testimony to this increasing demand. There is therefore a serious need for high-quality psychological therapy, and Mr Copeland has alluded to spoken therapies and counselling services, for them to be well organised and resourced and coordinated across East Belfast. I know that the Bamford Review identified the need for improved access to services and to develop a more coordinated framework for provision, and that we did have a good strategy launched in 2010, but that budgetary reductions to the implementation of that strategy have caused a lot of problems. Early intervention, prevention and treatment across all ages has been referred to today, and it is important that we help all ranges of people: mothers, children, young people, workers, older people, carers, and indeed people in the criminal justice system and who have experienced unique challenges in life as well. The provision must be multi-agency, and that the health service and the voluntary and community sectors do have an opportunity to work together, as has been mentioned. I definitely pay tribute to the many voluntary and community-based counselling organisations in East Belfast that are working in the most difficult of circumstances with limited resources to improve the health and well-being of members in our community. Adequate support for this work would not only alleviate pain and distress from mental health for individuals, families and communities, but it would prevent much more major crises from occurring further down the line. And I and my party certainly support the provision of community-based services that have been proposed by the Compton Review, but these have to be adequately resourced and organised. Support should be given to enable the health service and community and voluntary groups to work together. For example, to provide good communication so that people are aware of the range of services that are available, and there is some doubt with regards to the coordination of that at the moment. To provide appropriate referral mechanisms and supervision pathways. And as Mr Copeland and Mr Douglas have already mentioned, we know first-hand through the work in our offices that the economic downturn, welfare reform and other unique challenges in our constituency are having a negative impact on the health and well-being of our constituents, and it is incumbent on us to lobby for those additional resources that we need. This, combined with a recent history of the Troubles and deep division, means that there is a clear need to increase the availability of high-quality counselling and psychotherapy services in East Belfast and across Northern Ireland, and I sincerely hope that we can receive a positive response from the Minister in relation to the work on this area.